Hello? Are you okay? What's wrong with your tummy? Okay, wait for mommy. Mommy's coming home. Hello everyone, welcome back to another exciting episode of Ask Me Doctor. Today I'm going to have a chat with Dr. JoAnn on Parenting 101, food poisoning versus stomach flu. So thank you so much for joining us today, Doctor.
No worries, Eliza. It's always a pleasure to join, this session. And today I think the topic is very exciting, right?
Yes, very exciting. I have a lot of questions to ask you today.
Sure, go ahead. I'm more than happy to answer them.
For my first question, I do get very concerned when my daughter gets watery poop. How do I tell if it's stomach flu or food poisoning?
That's a very tough question indeed. So both stomach flu and food poisoning are two very different conditions.
Right.
While they both share actually similar symptoms, because in both you can actually have inflammation of the digestive system. So there's going to be symptoms such as nausea, vomiting, diarrhea, tummy pain, and even sometimes fever, but they are not the same.
I always heard people actually relate food poisoning with the terms like stomach bug or stomach flu. So could you explain more on stomach bugs and the difference between stomach flu as well?
Stomach bug or stomach flu basically are just layman terms to describe acute gastroenteritis. So it's caused by viruses that infects the digestive system. Usually these viruses actually spread from person to person, either through coughing or physical contact with other kids at school who are not feeling well.
I see, so it's kind of contagious.
Yes, it is quite contagious. After exposure to the virus, the symptoms that the child has can even linger for a couple of days, sometimes up to 7 days.
Yikes. I mean, that's very worrying as a parent for like myself.
Definitely.
So I understand that food poisoning happens because we eat unhygienic food. But how do stomach flus actually spread?
So stomach flu is extremely contagious because they spread rather quickly. An infected person can spread the virus to others from the moment they are not feeling well up to a few days even after recovery. Even contaminated surfaces can be a source of spread for this stomach flu virus.
So I heard of rotavirus. Are there any other types of stomach flu?
So rotavirus is the most common cause of stomach flu. It's very contagious and spreads through contaminated food, drinks, and even through people who are not feeling well. Rotavirus can cause symptoms such as vomiting, diarrhea, fever, and stomach pain. And after the virus exposure, the infection can actually last for a total of 10 days before these symptoms actually go away. To answer your question, other viruses that can cause stomach flu or viral gastroenteritis includes norovirus, astrovirus, and sapovirus. Interesting names, right?
Wow, 3 different types of viruses.
Exactly. And these viruses all cause similar symptoms to your rotavirus.
How do I know when it's food poisoning and not stomach flu?
I do agree that it's very difficult to distinguish between food poisoning and also stomach flu because the symptoms are similar, right?
Almost, it's similar.
However, there are some differences between the both of them. So here are some of the points to help you determine which one you are actually facing with. Firstly, food poisoning usually occurs within few hours after eating something that is contaminated. And the symptoms that come can be, as I mentioned earlier, nausea, vomiting, stomach pain, and even diarrhea. Now, the symptoms sometimes can be so severe and may include fever, headache, and also body aches. On the other hand, stomach flu tends to take some time to develop. There's a period of incubation period, so after the exposure of the virus. So these can be within 5 days or 7 days after exposure, and that is where you suddenly get symptoms such as nausea, vomiting, tummy cramps, fever, and even headache. While diarrhea is often a symptom that most parents would be rather worried of, the main issue with having gastroenteritis or stomach flu is the risk of dehydration, especially in young children. Every parent should be very aware of what are the signs of dehydration that they should be very concerned of. So the first would be passing dark urine, having a dry mouth, having a fast heart rate, or even dizziness, especially while standing. So if your little one is having any of these symptoms whenever they have a bout of vomiting or diarrhea, please seek medical attention and please bring them to the nearest hospital to get them checked out. Acute diarrhea can be very dangerous in children and even more so than adults. That is because their immunity and their gut system are not mature enough to support them to fight against the infection and also to cope with the big volume of fluid loss.
So you mentioned about acute diarrhea. What is the treatment for acute diarrhea?
Usually diarrhea symptoms can go away after a few days. However, we need to stop and treat the symptoms to prevent dehydration, especially in children.
I see.
Now, the main treatment in acute diarrhea is to replace loss of fluids. And this can be done by giving sufficient amount of oral rehydration solutions which contains the right balance of water, sugar and also salts. Next is to always offer very bland but easy to digest foods. So most of the time a lot of patients would ask, and these foods are rice, toast, bananas, applesauce, boiled potatoes and crackers because they are all good low fiber options to replenish the nutrients lost.
So I would say those are easier to digest, right?
Yes, and always avoid anything that is oily, spicy and sugary because all these foods can actually worsen diarrhea.
Okay, that's actually very good to know.
So the next one would be, of course, serving anti-diarrheal medications. So this can also be given on top of oral rehydration salts to promote a faster recovery. Not to forget, get your child to have adequate rest and avoid any vigorous activities to help them in their recovery. So when it comes to diseases, prevention is always better than cure. By practicing good hygiene such as frequent hand washing, avoiding sharing of food and utensils, and frequently disinfecting surfaces that may be contaminated, this can significantly reduce the risk of getting diarrhea.
So as a mom, I will actually want something for my little one as well. So doctor, are there any suggestions for parents like me that you recommend on?
So for children who are more than 2 years old, there are some anti-diarrheals available to help to treat with the symptoms and speed up their recovery, such as 𝗂𝗬𝗪𝗏𝗏𝗏, 𝗨𝗏𝗪𝗏 and even probiotic. 𝗂𝗬𝗪𝗏𝗏 can trap and remove harmful substances including toxins, bacteria and viruses, and it provides very fast recovery when the child has acute diarrhea, thus preventing dehydration.
Alright.
So this will of course help your children get back to their normal activities in no time. Now, 𝗨𝗏𝗪𝗏𝗏 acts by slowing down the bowel movement and hence it does help to relieve the diarrhea episode. Don't forget about probiotics because probiotics is really important because it helps to suppress the germs that causes diarrhea in the first place and help body to fight against them.
I think I've forgotten to mention earlier that my little girl is only 2 years old. Can she take the ingredients that you mentioned earlier?
Yes, definitely. So for any 2 years old child and above, you may try the combination of 𝗂𝗬𝗪𝗏𝗏𝗏 plus probiotic whenever your little one has a diarrhea. You may give 𝗂𝗬𝗪𝗏𝗏𝗏 to help them to clear up the toxins in the gut, and then probiotics can be given anytime 2 hours later to replenish good bacteria in the gut, thus helping your little one actually recover way faster.
Yes, it's always about effective recovery when it comes to the little ones, right?
Yes.
Doctor, so I do have another concern as a parent. I think a lot of parents out there will actually be able to relate to my concern, and it's actually the fact that my daughter doesn't like the taste of medication. Sometimes it can be very challenging for me to get her to actually consume medications when she needs it. So would you have any experience or advice to share with me?
Definitely, Kate. Don't worry, you are not alone. Now, the good thing is anti-diarrhea medications such as 𝗂𝗬𝗪𝗏𝗏𝗏 comes in various flavors that I'm sure children would actually accept because they are very palatable.
Okay.
So 𝗂𝗬𝗪𝗏𝗏𝗏 comes in strawberry flavor, orange vanilla and even caramel cocoa flavor. And the good thing is they're available in powder form and ready to use sachet for convenience. Not to forget, some probiotics are actually available in a chewable tablet form.
Since you mentioned earlier it comes in 3 different flavors, I actually found that really interesting, and you kind of triggered me to actually stock up some at home in case of emergencies because it comes in really convenient, ready-to-go packs, right?
Yes.
Yes. So thank you so much for the recommendation, doctor.
You're most welcome.
To all our viewers out there, don't forget to join our contest to stand a chance to win the Motherhood's Ask Me Doctor Wellness Box and merchandise from EP+, which is a pink shark soft toy and pill box with these simple steps. Step 1. Answer in the comments down below. Name one example of anti-diarrhea for children aged 2 and above. Step 2, tag 3 friends and share this post. Make sure that your account is in public mode. So special thanks to EP Plus for sponsoring this episode of Ask Me Doctor. We hope you enjoyed and learned from today's program. Stay tuned for our next episode of Ask Me Doctor for more health tips for the family. Thank you for watching and we'll see you again next time. I'm 𝗂𝙑𝗧𝗧𝗧.
And I'm Dr. JoAnn.
And this is motherhood.com.my.
Bye-bye.